Welcome back to Links 24. This is the June edition of Whitney's Healthcheck. I'm Whitney Sanjari, the community health educator at Tomah Memorial Hospital, and I'm joined by occupational health registered nurse Angela Krieger. And this month, we're all about lung health. Angela will be sharing a few tips for good lung health and how a pulmonary function test can help determine just how well your lungs are functioning. Thanks so much for being with us today,
Thank
Angela.
you for having me.
Wonderful. Okay, so Angela, you work in the occupational health department,
Yes.
right, at the hospital, which, just a little plug here, we're opening up our new occupational health department coming in the fall.
Yes,
right, so
very
you have your
exciting time.
own building in the industrial park.
Yes.
But one of the things that you do, Angela, is something called a PFT, or a pulmonary function test. What is that? So just tell me what a pulmonary function test does and why it's done.
Okay, so basically a pulmonary function test is just a test to test your lung function.
Okay.
Make sure it's working right. You know, you use your lungs for everything. You breathe air in.
Yeah, kind of important.
Yes. So
Okay.
basically the test just tests your ability to inhale air, exhale air, and if you can exhale it pretty fast. That's all it's testing.
So like how strong my lungs are.
Yes.
Okay, so we've got some printouts here of something from the PFT. So these are actual PFT printouts, right? So kind of what this is measuring here, right? We've got that big curve up. Is that like my inhale? Is that what that is?
Yep.
Okay. And then we've got our exhale out. So this is what like a healthy lung will look like. And this is an actual lung from a patient that was 25 years old. And this one is like, his lungs are younger than that, though, aren't they?
Yes, yep. The lung age actually shows it's less than 20, so very healthy lungs.
Okay, so I mean, why are his lungs healthy? What makes a healthy lung?
Pretty much what makes a healthy lung is, taking care of your lungs. No smoking. If you're staying around, if you're around a lot of chemicals or dust or anything, protecting your lungs. You don't want that stuff that doesn't belong in there. So keeping that out of your lungs is the best way to keep them healthy.
Okay, so protecting them, prevention is better than on the back end here, which we have lungs from a smoker here, don't we?
Yes,
okay,
we do.
so this is an actual PFT, or pulmonary function test, from a smoker. And you can see in there, like the green is, what's the green line here?
The green is kind of the threshold of what you want to meet. So that this person was actually 21 years old. So their age and, what they should be able to at least hit that kind of benchmark for a breathing test.
Okay, so the green is where they should be, and this is a smoker who is 21, and the red is where they're at. So that means like his lung age is
56.
59. So he's 21 years old, and his lungs are 59 years old, according to this, based on because he's a smoker, right? So that has a huge impact. Another thing that has a really big impact is obesity, which I didn't realize that would have a huge impact on how your lungs function. And so when we talk about taking better care of our lungs, Angela, how do I do that? So if I'm in a place where I'm going to be painting a lot.
Yep.
Right? What do I do?
There's things you can do just if you're around the house and you're painting, you're dealing with a bunch of dust, anything like that.
Okay.
You can buy easy, cheap dust masks. They're at all hardware stores. It just helps protect. It's a filter, so that air is not going to be not breathing
in my
into your
lungs.
lungs.
Okay.
Yep.
So now this is a dust mask that we have here. This is like a heavy duty one, which you wouldn't have to necessarily have this heavy duty. Would you recommend like the 2 straps to keep it on, or is the 1 strap okay?
The 2 straps does hold a little better. I've worn these a couple times too, so it does hold a little better. So I feel you get a better seal around. But
okay, so I'm gonna put this on. You're gonna tell me like how do I know what a good fit is? Yeah, get my hair back here and get ready. Oh, things are getting messed up. Okay, so what's a good fit?
So a good fit, you have the 2 straps there. So if you have this kind of comes above your ear and one comes below, because then you can kind of feel it. It kind of evenly holds it around your nose there then. And then this is a little adjustable. There's a little metal piece on there.
Squeeze that?
Yep, you just squeeze it. It comes to your nose a little better too for more protection.
Now what if the here, I'm gonna take this off now. What if the air is like I feel it coming out the sides?
If you feel it come out the side, you're not having a really good seal. So you just want to either try to readjust it. You can tighten the straps a little bit if you need to.
Okay.
That helps protect the air from getting into.
Okay.
Those seals.
Oh, I didn't realize that. I can even pull on these and it tightens them. Yep. Okay. Wow, that's really neat. Yeah. Okay. So we actually brought in the PFT test, so we can we're just gonna do a mock one. We're not gonna do a full one, right? So when we're doing the PFT test, I have to what do I do? I inhale and then.
Yep. So you also get the fancy nose clips to wear too.
Oh right.
Yeah. Can't forget about those.
Ooh. This is gonna be great. Okay,
that helps prevent you from taking an extra breath when you're doing the test.
So I would just inhale quick. We just have just a couple of minutes here.
Yep, put the mouthpiece in. You do a big inhale and push it out. And that's basically it. Yep.
All right, we do that a few times.
Pretty painless, but.
All right, so real quick, Angela, that was just a quick, it's a little bit longer than that, but what's one thing you would recommend for people to keep their lungs healthy?
I think the main thing, if you are a smoker, quit smoking. That's one of the biggest risk factors that can cause anything like COPD, emphysema, anything like that. And then if you're working in any jobs or around the house with a lot of dusty environment and everything, protect your lungs.
Painting,
yes, painting.
that kind of thing. Okay.
Yep. Wear protection. It does
wear protection like this, just this, really easy. Yep. So it may not be as comfortable, but it's going to help your lungs in the long term to be healthy. All right, so wonderful. Don't forget that you can find this and past editions of Whitney's Health Check on the Links 24 Facebook page. We need to take a short break, and when we come back, April and Nick will be filling you in on what's coming up in the community.